If you're confused between what to choose, OBA or conversion program, you have come to the right place. Hi everyone, this is Jessin from Edulogics, where we teach you logic behind things. Welcome back to my channel, and in today's video, I am going to discuss a very hot topic: what to choose, OBA for nursing registration or go for the conversion program for nursing registration in Australia. Make sure to check out this video till the end, as at the end I will be telling you what is my personal opinion about both the programs, and that may help you to make an informed decision. So conversion program is a fast-track Bachelor's of Nursing program which is done by very selected universities in Australia, and you can do this program if you're an overseas qualified nurse with a Bachelor's of Nursing degree. So traditionally, the BSc Nursing program or the Bachelor's of Nursing program in Australia is a 3 years degree program, and since overseas registered nurses who have done their Bachelor's of Nursing in their home country have already done the qualification, so what they can do is apply to these selected universities and get some recognition of prior learning for whatever experiences as well as the learnings that they have done during their graduation program, and hence the duration is shortened from 3 years to 1 year. The good thing about the conversion program is that after completing the 1 year program, you are eligible for a direct registration with Australian Health Practitioner Regulation Agency, provided you meet all the English language requirement, criminal history standards and other standards. Now, since this program leads to registration, it is a very popular program among nurses, but very competitive to get in. So now let's discuss what are the entry requirements to get into this program. So the first entry requirement is that you should already have your English language proficiency test results in your hand before you apply to these universities. You can opt between IELTS, PT or OET, and the level of language required is same just as an OBA, which is IELTS 7 band, PT is 65 or OET level B. The other requirement by most of the universities is that you should have minimum 6 months of experience in acute care setting in the last 5 years. Also, few of the universities may prefer recent graduates rather than those graduates who have done their graduation long ago, like 10 years. As each of the university may have specific requirement, my recommendation would be to check out the university website to understand them in detail. As international nurses, you will require the visa to do this program, which should not be difficult if you have a clean history. But very important point to remember here, this program does not give you any kind of post-study visa, which is very common in other programs. Since this is a 1 year qualification, you are not eligible to stay after that through a post-study visa program. For example, let's say you have done your Masters of Nursing in Australia, you get 2 additional years to stay back and work here. Whereas, since this is a 1 year qualification, you will not be able to get any post-study visa, which means after completion of this program, you need to immediately find a way to stay here in Australia. Let's talk about the fees now. Now, the fees depends upon which university you go for. However, it ranges from somewhere between $37,000 to $47,000 for this 1 year program. Let's also talk about the intake dates. Most of the universities who are doing this program are totally full for 2022, and hence most of them are taking admissions only in July 2023 or March 2023. So based upon whenever you're watching this video, definitely consider 1 year waiting period to enroll in this program. So now let's see which all universities offer this program. Now, if you're in Melbourne, Deakin University offers this program. And if you're in Perth, Curtin University as well as Edith Cowan University offer this program. Unfortunately, such program is not available in New South Wales or South Australia, and hence you may have to consider migrating to Melbourne or Perth if you get the admission in this program. Now let's talk about job prospects. So after you have successfully completed this program and have got your nursing license from Australian Health Practitioner Regulation Agency, you should be able to get a job as a fresher nurse or a graduate nurse. There is one disadvantage here, especially for those who are experienced nurses, because you are entering the healthcare system as a fresh graduate nurse. your previous experience of employment in your home country or wherever you have worked will not be considered by employers because you are starting as a fresh graduate RN Division 1 nurse. Now that you have a good understanding of the conversion program, let's do a quick comparison between OBA and conversion. So the first variable that I have put in is time and mode of delivery. So in OBA, the time can be variable because it depends a lot about when a nurse is able to pass the NCLEX and OSCE examination and how many attempts that a nurse may take to pass this exam. Generally, nurses who are focused and hardworking are able to pass both the exams between an average time of 6 to 9 months. And because in OBA, all what you need to do is pass the NCLEX and OSCE examination. So hence there's no formal training. You can go for coaching programs which are mostly online with very little component of face-to-face training, which means you have more time to work as well as study. Whereas in the conversion program, the 1-year qualification is delivered full time. The second important factor, which I think most of you have in your mind, is fees. Now, if you consider OBA, the rough estimate of your examination fees is less than $5,000. And depending upon whether you go for your NCLEX and OSCE coaching, add another $4,000. So the OBA program definitely sits under $9,000. Whereas, as I mentioned before, the conversion program can cost you from $35,000 to $45,000. Now let's talk about the entry requirement for both the programs. So in OBA, IELTS, PT or OET scores are only required at the end of the process, which is after the OSCE examination. And whereas in the conversion program, you need these scores before you start your university program, even before you apply to the university. Also, in the OBA program, if you're a fresher nurse or you do not have experience, that is fine because APRA is conducting these two examinations, NCLEX and OSCE, to assess your competency. And if you're able to pass this examination, registration should not be a problem. Whereas in the conversion program, it is mandatory that you must have minimum 6 months of acute care experience in the last 5 years. So the next factor that I think again is very important is clinical placement. So in OBA, there is no clinical placement requirement. All you need to do is pass the NCLEX and OSCE examination. Whereas in the conversion program, you have to have the mandatory work placement, and generally it can constitute from 800 to 900 hours in this 1-year program. So the next factor is how many exams you have to write in both these programs. So for OBA, only 2 exams are there. Whereas in conversion program, of course, every unit you'll have to submit your assignments, your assessments, as well as do your competency-based examinations and also OSCE practical examinations. So let's talk about job prospects now. Now in OBA, because you have completed these assessments done by Australian Health Practitioner Regulation Agency, you will be able to show your experience to your employers who are hiring you, and you may be able to get a job which is higher than Division 1 based upon your previous experience. Whereas in conversion program, as I explained you before, you will be joining the healthcare industry as an RN Division 1 nurse, which is basically a graduate nurse. In both the cases, the salaries do differ. I'll give you an example. If you are a fresh graduate nurse, you will be earning somewhere between $33 to $34 per hour. Whereas, let's say if you are an experienced nurse with 5 years of experience, you will be earning between $40 and $42 per hour. So now let's see what is my opinion, which one is better, OBA or conversion. Now, in my opinion, it depends upon your individual circumstances and what you're going through. For example, I have seen few nurses who were unable to pass the NCLEX examination even after 3 or 4 attempts, and then after that they decided to go for the conversion program because they were able to meet the entry criteria and they could afford it. Whereas if you're an overseas registered nurse who has not started the OBA procedure and you're just planning to start with NCLEX, I would definitely recommend you to give it a shot and give it your best try, because 100% OBA is a much more affordable as well as beneficial program to choose in the longer run. So that's a wrap up for our today's video. I hope you liked this video. If you did, make sure to subscribe to my channel as well as like and share this video with your other nurses. So what is your opinion about both the programs, OBA versus conversion? Make sure to leave them in the comment section below and also drop in any questions that you may have about both. I am happy to support you in both the programs, OBA or conversion, whichever you choose. Thank you everyone for joining. Until next time, stay safe and stay happy.